My name is Dr. Thompson, fellowship trained foot and ankle surgeon. Today we're talking about ankle instability, why it's one of the most underdiagnosed and undertreated pathologies in the ankle. There are many forms of ankle instability. Essentially, ankle instability occurs when patients have lack of confidence and or lax ankle. This predisposes patients to having recurrent ankle sprains, either acute on chronic type of issue or just a chronic instability type of problem. The etiology of ankle instability is multifactorial. Genetics, environment, and or previous injury can all play a role. The most frequent cause of ankle instability is recurrent ankle sprain, at which point the ligaments, particularly on the anterior and anterior lateral aspect of the ankle, become lax and to the point where they cannot function properly. Ankle instability is often underdiagnosed for a multitude of reasons, including in the setting of acute trauma. Oftentimes patients go to an urgent care emergency department, get x-rays or a CT scan, which come back negative, but it's the ligamentous type of injury, stretch, or tear of the ligaments on the outer aspect of the ankle, which go underdiagnosed and undertreated because there's no fracture present, and patients often get back to sport or activity much quicker than they should and without the proper guidance of a physical therapist or a foot and ankle specialist. This prolongs and can cause a chronic type of issue as those ligaments aren't given the proper time to heal. Proper diagnosis of ankle instability should include a very thorough clinical exam, as well as sometimes getting more advanced type of imaging, such as an MRI, to really evaluate any pathology with the soft tissues, particularly in the ankle. In certain instances, an ankle sprain can be more severe than an ankle fracture. That's why it's important and paramount to get evaluated by a foot and ankle surgeon. Ankle instability can be placed into two categories, including functional and mechanical instability. Oftentimes, mechanical instability I can appreciate as a clinician and a surgeon evaluating a patient on a table. However, there are some instances where patients experience functional instability where it's hard to appreciate from a clinical exam. However, when they're playing a sport or in mobility, they have significant pain, lack of confidence, and ligamentous laxity. One of the main contributors to chronic ankle instability is due to the lack in the injury of proprioceptors within the ligaments themselves. In other words, we have neurons in the ligaments of our ankle which help tell our body where we are in space. However, when you have recurrent sprains and injuries to those ligaments, we no longer can appreciate the tension within the ligament itself. Therefore, when we're playing a sport or dynamically exercising, we lose our ability to stabilize our ankle. Surgical treatment of ankle instability has changed over the years. We're now to the point where we have the technology and the advances where we can repair a ligament or augment it in a fashion that is almost consistent and similar to the native type of ligamentous tissue. Not only does that provide a more dynamic and robust repair, but it also allows patients to get back to sport and return to function more quickly. Proper diagnosis and conservative measures of treatment are paramount for success in the interim and long term after a significant injury or sprain of the ankle. My name is Dr. Thompson, and again, if you are suffering from ankle instability, either in the acute setting or the chronic setting, come to Atlanta Foot and Ankle Center. Happy to see you, happy to meet you where you are along this journey and discuss further treatment methods.